Hi, everyone. This is Rico Figliolini, host of Peachtree Corners Life. I appreciate you guys joining us. Special guests today, we have Erica Dumpel, founder and CEO of CDA Inc. Hey, Erica. Nice to meet you.
Hey, nice to be here.
And we have John Czajkowski, who's the president of the same company. This is a family business, and John is Erica's son, who joined the business back in 2009, I believe, if that's correct, right?
Correct. Yep.
Cool. And the business of what we're going to be discussing today is health insurance. As you may all know, at some point, this is all open enrollment coming up soon. If you're close to retirement, you may be thinking about Medicare or options there. So we're going to have a conversation today about that. I'm going to let Erica and John sort of lead us down this road because I don't know enough to always ask questions, and I'll be asking questions at the right point, I'm sure, because I'll be heading into deciding whether I want to do Medicare or what I have to do with Medicare come 2024. But you all came off a meeting this morning from downtown Norcross where you met a bunch of people, I think, or Erica did, where they had questions about health insurance and such. So, but before we get all into that, why don't you tell me a little bit about yourself, Erica, and we'll do the same with John.
Okay. Erica Dumpel, I came into the health insurance industry in 1975, so I have seen a lot of changes. We have a family business here in Peachtree Corners, actually in Tech Park. We have a staff that supports small group businesses, which is generally companies under 100 employees. We have a commitment to the individuals who work in those businesses or who are not covered through group insurance, as well as seniors who are having to grapple with the decisions about Medicare, depending on the size of their employer. Do they have to have it? Do they not have to have it? If they are retiring, if they are not retiring, a lot of questions around that. And Rico, I know what you're starting to go through with the mail that you receive about all this as well, so it can be a little daunting.
For sure. John, tell us a little bit about yourself.
Okay. So John Czajkowski, I am now president of this family-owned insurance brokerage. I took over responsibility of the day-to-day as of January this year, 2023, and I've been doing this since 2009. As Erica mentioned, have also seen a lot of change with the Affordable Care Act happening in 2014. And with the way that the markets have adjusted to all of these new legislative requirements. I'm also a very involved member of a trade association, the National Association of Benefits and Insurance Professionals. As of right now, I'm the president of Georgia, and I'm responsible for over 460 brokers that operate in the health insurance markets in this state.
Cool. So insurance has always been complicated thing, I think, for people. Certainly it has been for me and everyone that I talk to. So many options. The state of Georgia is different than the state of New York, let's say. Every state operates a bit different. The mechanisms that can be used, and you're right, things have changed. I mean, I remember going on healthcare.gov at one point. I don't even know if at this point it's necessary or if that's where I need to be on at some point. I do have an employee insurance at this point, but I may be looking at moving off that, or will be moving off that when I turn 65 next year, I think. So these are all things that I think everyone has an issue with as far as getting some straight answers. So where can we start that makes sense, Erica? We'll start with you. At what point, where should we start on this?
Okay, first, let's just start with it's the worst time of year because everything is crushed into the end of the year. So the pressure of the Medicare open enrollment, which starts on Sunday. So between October 15 and December 7, there's a lot of information out there for seniors. Then the individual open enrollment starts November 1 and goes through December 15 for a January 1 effective date. And add to that, the majority of employer-based plans renew in January. So there's a lot of information floating around. So where do we start? It depends who you are, what you're up to. So if you are a Medicare person and you have a drug plan or a Medicare Advantage plan, you really need to go out to Medicare.gov Go through the breadcrumb trail, look at what the plans are for next year, make sure you're in the right plan at the right pharmacy. If you are covered by individual insurance, it's time to start looking and preparing to look at healthcare.gov to make sure that you know what's going on out there. If you are on an employer plan, you should be receiving some kind of outline of future options in terms of deductibles, copays, plan designs. A lot of decisions to be made this time of year. People like us exist either as brokers for certain people or as consultants for others, depending where we can be of the biggest help.
So, so handling, let's start with age groups, I guess, would make sense. Let's start with my age group. I'm going to be a little like selfish here. So I'm heading into 65. I'll be 65 in April, the beginning of April. So January, February, March. I'm told that January I should start looking at Medicare. What exactly, in brief, what are the bullet points, if you will, of what I should be doing come January?
You need to go out to Medicare.gov, make sure you have a My Social Security account so that you can go in and enroll in Medicare Parts A and B. It's not difficult, but be very careful. There are some odd nuances right now. I've run into some stuff recently that surprised us. One example, I did an enrollment with someone, the address was correct, except the country was listed as Afghanistan. That will botch things really badly.
Yeah,
and then they want you to send your original birth certificate to some address. No, we don't do that. So if you can be 3 months ahead of it, do that, because if there's going to be a glitch, that's where it's going to be, and no one has jurisdiction over the government. So we all have to untangle that stuff.
Okay, so when people do this and they apply, you shouldn't have to submit any documentation because the federal government should already have that in the system.
Unless there's an error. And the Afghanistan, I think, was some kind of, I don't know, space marker or something to tell somebody that the date of birth actually did not match what the individual put in. So the government had the wrong date of birth.
Gotcha.
Bizarre.
Okay, so if I have issues and I decide that, okay, I can't go through this, can't handle it, would your company do this for me?
Yeah. I act as a Medicare counselor, and we actually bring people through the enrollment. There's a PDF and a PowerPoint that explains Medicare ABCD, Medigap, why would I do this versus that. So it's a full consult. We do charge for that. We can also then help with the enrollment in any parts of Medicare. We are agnostic, Medicare Supplement, Medicare Advantage, it doesn't matter. But we really become the guide down this path.
Okay. So that's pretty much what needs to be done if you're 65 or older, right? I mean, that's basically just you need to make sure you're on it. You apply for it 3 months out. You don't want to wait until you're 65, or certainly do it after you're 65.
Yeah.
Right.
If you are late without proper coverage, there are penalties. There are waiting. I mean, there are future dates. If you miss your open enrollment completely, you can only enroll the first quarter of the following year with the July 1 effective date. Imagine not having coverage for that long.
Right. So, and people don't have to be, quote, retired, taking retirement benefits to take advantage of Medicare.
In fact, for anyone who is employed, be very careful if you work for a company that has less than 20 employees. If you don't have Medicare Parts A and B in place, the commercial insurance carrier reserves the right to not cover the charges that Medicare would otherwise be responsible for. That is a huge hole in your coverage.
Okay, I didn't know that. So being with a small company, 20 less employees, I turned 65, I'm on that private insurance. I really need to be on Medicare, is what you're saying to me.
Absolutely, yes.
Okay. Otherwise you get penalized, which I guess makes sense because that private insurance company says, "Whoa, why should we be paying for this? The government pays for that."
Right? Medicare is primary. Yep.
Okay. All right, cool. All right, so now let's go a little further younger, if you will. So we're in our 40s, 50s, maybe 30s. We're private insurance likely, or maybe an individual insurance if we're not employed, or if we're 1099, that's a whole different story, where we're self-employed, and how do we do that? So Why don't you break that down for us? Who wants to take that? John?
I'll
That,
take that.
that's John's
So,
department.
as I mentioned, 2014, the game changed, and a lot of people were forced into purchasing private health insurance on the individual market, or they got penalized.
Mm-hmm.
Uh, Unfortunately, politics plays a large role in our industry, and without pointing any fingers, both parties they have taken my industry and picked it up like a football and ran with it. So, with that in mind, in the state of Georgia, we are still operating with healthcare.gov as the primary shopping and comparison tool. But our governor is very quickly building out a state-based exchange. So many states, both red and blue, they have pursued this, and it gives the state a lot more control over how monies are divvied up and enrollment platform build outs, as well as being able to kind of puff out your chest saying, hey, we enrolled X number of bodies.
Right.
So that just got halted by CMS under this new federal administration. And I do expect it to be the primary shopping portal for 2025 open enrollment. So you likely have seen some commercials, probably during the UGA games, for Georgia Access. And I would
Mm-hmm.
encourage your listeners and watchers, go check out the website right now. It is a little eye-opening what we were prepared to move forward with, because it is not, in my opinion, ready for prime time. I have been working in my other role as the president of Georgia, trying to encourage the state to reassess how we are approaching this. We were going to be the only state in the country that had pursued a state-based exchange without having a centralized shopping and comparison tool. Once we flick that switch, we lose access to healthcare.gov, which has a lot of federal funding built into it.
Mm-hmm.
And that's something that I've been very involved with, trying to make sure that when they do flick that switch, it's ready for prime time. But healthcare.gov right now is still the best shopping tool that I use in this office. It does show you all of the options that are out there. And another thing to consider is, with a number of federal legislative changes and bills that have passed in the past couple of years, the thresholds for eligibility for financial aid or subsidy have been significantly expanded. Just a couple of years ago, a family of three, older parents with kind of younger to middle aged child, or middle age, in their 20s,
Right.
with a household income of, let's say, $100,000, you would not be eligible for anything, or a very small, a pittance of a subsidy amount.
Mm-hmm.
That's free money from the government that you have applied towards your premium, so immediate discounting. Nowadays, I can take that same family and they are very likely eligible for several $100s a month in financial assistance. Again, free money from the government. It is designed to be applied towards your premiums, and that's how this system should have been running since 2014. But with a national rollout of a program like this, and with politics playing a role in it, one side of the fence holds the purse strings, and the other side, they're able to pass substantial laws. And there's got to be some sort of meshing of the two in order for a system like this to be successful. So now we have an opportunity for the next couple of years to really take advantage of the aid that we were supposed to have been receiving this entire time. So if you have gotten a bad taste in your mouth over the years with your individual insurance and have not gone back in to reassess, do it. You might be surprised with what you're eligible for.
It sounds surprising, because I do remember going on healthcare.gov some years back, and I got subsidized. My income was a little different than it is today, and but I didn't see that subsidy later as my income grew, and so this sounds totally different than it was before.
It is.
And if I
Yeah.
and if I remember correctly, I think part of the healthcare.gov, like 80-90% of it was being covered by federal funds. But at some point, 4, 5, 6 years into it, the state is supposed to take over the bulk of the money being used, I think. Or at least that's the way it was at one point, right? Funding that the state would pick up more funding,
Mhm.
a bigger formula percentage portion of it. And is that why the state is trying to move towards their system? Because it sounds like the Georgia Access would be would actually give fewer people coverage because of income and other things, and also provide less coverage even if you were able to get it. That would give you less coverage on your insurance. So is the state trying to? Um,
It's I'd say it's more of just a platform at this point.
hmm,
So like healthcare.gov, it's just an enrollment tool.
okay.
And that's what Georgia Access at this stage is looking to be. When the when the switch gets flicked, then the state is going to have a lot more say over eligibility for subsidy and the
Right,
actual dollar amounts that you are able to pull from the system.
right.
But at the moment, I'll say, thankfully, we're not at that stage yet. There's still some tweaks that need to be made on the website,
Hmm.
and I'm hoping over the next couple of months and into first quarter of next year that they're going to have a lot more traction with what I'm hoping they're building right now.
Okay. Okay, but essentially though, once a switch is done and it's in state control, they will control how much money they will fund,
They
who
control the
are
whole thing.
okay.
There's some
So who's
federal guidelines
approved?
that they have to follow, but
Right,
ultimately the state makes a lot of
right,
rules
right,
that they want us to
right.
adhere to.
Okay. All right. So fine, we're not there. I guess we're not there yet. So I guess that's okay. Um, as far as picking plans now, if come this enrollment period, what should families be looking at that are, I guess, what would be the better thing to start with? Families where the head of household is self-employed, or families that where the parents are full-time employed with health coverage. Where should we start, and how should they be looking at that?
I would say start with the families that are employed because a large percentage of people have their coverage through their employer.
Hmm.
And generally, there will be a couple of options, high, low, high, mid, low type of thing. And the thing that we've always asked people is, how do you use this? Okay, do you have something planned? Are you having a hip replaced? Are you on a program where you have constant need for treatment? Do you have a bunch of little kids running around with tubes in their ears and you're at the pediatrician every
Right,
week?
right.
That person is different from a lot of the other people who say, I never use this stuff. I don't, most guys don't even have a doctor's visit until they hit their late 50s when things start to
Mm-hmm.
go wrong.
Mm-hmm.
So look at a high deductible, look at how much you're saving, look at what you're putting at risk. If there's an opportunity to be in a high deductible health plan that allows HSA contributions, certainly jump all over that. Tax deductible money set aside that if you take it out for medical expenses you never pay taxes on
Mm-hmm.
with a lower premium, that's a win-win. So
Okay.
from that perspective, that's kind of how we look at it on that side. John looks at it similarly on the individual side, but jump on in on that one.
Yeah, there aren't nearly as many plan design options on the individual market. There's usually
Mm-hmm.
I really go in with the mindset of there's a template out there with three different plans that really are consistent across the board with every insurance carrier. There's going to be one plan on the lower end. It's going to have a higher deductible, usually in that $6,000 to $7,000 range. You
Right.
get co-pays for the bare necessities. You get the sniffles and go to the PCP. You go to a specialist, you got a flat dollar amount every time you go in for that. But in a lot of cases, you go in for blood work, you go in for advanced imaging like an MRI or a CAT scan, all the way up to hospitalizations and outpatient surgeries. All of that is applying towards your deductible. As long as you stay in the network, you're going to get a discount, which is probably going to be a substantial reduction in your expenses.
Mm-hmm.
But whatever's left over after that discounting, that falls on you and that applies towards your deductible. And for a lot of us, like myself, I'm 37, knock on wood, I don't really have much going on. That is probably where I'm going to gravitate. I don't necessarily feel the need to prepay in premiums for a plan with a $2,000 deductible. The way I look at it is if I am buying this for the big stuff, I'm not buying it for the piddly little copays and things. I'm buying it if I get in a car accident on 285, if I fall off a ladder and break my arm, if I'm diagnosed with something horrible that's going to turn into a chronic illness.
Hmm.
I'm really concerned about my out of pocket maximum. So that's the most that I can be responsible for if I have a bad year. When you look at most of these products on the individual market, the out of pocket maximum is generally in the same ballpark. Might be a couple $100 difference between a plan that my premiums are $600 a month versus a
Hmm.
plan where it's $1,000 a month. And when I'm looking at that direct comparison, I've got to think about how am I really intending to use this? If I'm treating it as a catastrophic product, I'm not really going to get much out of that lower deductible plan design. And I'm going to be guaranteeing that I'm spending more money on my premiums every single month. So in that instance, I'm more than happy to take a little bit more risk on the front end with a higher deductible, knowing that my out of pocket expenses in a worst case scenario, I'm not going to be that far off. And then the HSA component on some of these products, if you're young and healthy, if you've got nothing on the radar and you are truly treating this as a catastrophic product, you have
Hmm.
no intention of using daily usage benefits, um, that's something that I absolutely take advantage of. And I think a lot of our clients in all age ranges should be considering because, as Eric mentioned, I'm allowed to take money from my checking account and transfer it over to a health savings account. That is a
Right.
tax deductible contribution. And it's not a use it or lose it. It just sits in this account waiting for the rainy day, waiting for the big something that pops up. For instance, my wife and I had a kid last year.
Hmm.
I had to pull her onto my policy so that we could deliver at Northside, the baby factory in the Southeast.
Right.
Um,
Yes. Okay.
In
Still.
doing so, we had a $6,900 out of pocket maximum. 3 days in the hospital, epidural, the whole thing. She
Uh-huh.
maxed out her coverage. And so, with that, I had been preparing financially by maxing out my HSA contributions.
Sure.
When it came the time for me to pay that bill, I swiped my HSA debit card without having to have a garage sale, without having to ask mom and
Hmm.
dad for help.
Right.
I was
Right.
incentivized by the IRS to financially prepare for future medical expenses. And so, with that, yes, the small things are going to sting a little bit more because you're not getting a copay for it. But for me, I don't use this stuff. So
Right.
that's not a big deal if I have to pay on a cash basis a couple $100 for a specialist visit or something like that.
Hmm.
That's kind of how we approach this with all of our clients. It's really a needs-based evaluation,
Right.
and tell us, what do you have on the radar? If it's nothing, are you really going to get your money's worth by going to a richer, more expensive product?
So let me ask you on the HSA, for example, that's mainly used for deductibles or that's not used for anything else. I mean, you can't pay for a health club membership. I mean, it's not made for that, right? It's made
Not
simply to,
really. It's really intended for any type of care for your body, whether it be
okay,
your mouth, whether it be your eyes, whether it be your internals, whatever.
right.
If I go to my annual physical,
Hmm.
that office visit should be complimentary.
Right. Okay.
But
And
when
that,
they draw blood and they ship it off to a third party, think Quest Diagnostics, LabCorp, something like
mhm,
that,
right.
that is by definition a diagnostic evaluation of my blood. I will have an expense for that. I can absolutely use my HSA dollars for that expense. I can
And,
use it for prescriptions, whether I'm getting my discount through my plan or
mhm.
using GoodRx or another discount program out there. It's quite literally almost anything revolving around the care of your body.
Okay. So, and you don't lose it. It stays with you. It's a tax deductible. What's the maximum you can put into an HSA in a given
It
year?
shifts every year. For
Okay.
2023, someone under 55, the maximum you can put in is $3,850,
Okay.
but it is prorated. So for every month that you were on an HSA eligible product, you can put in that calculated whatever dollar amount it was.
Okay.
But 3850 is the most you can put in over a 12-month period. If you're over 55, you get an extra $1,000 to dump in. And
Hmm.
that's just for an individual. If I have another person on my coverage another HSA eligible product in my family, we both get to make a contribution to that HSA. And so when we're
Yeah.
talking about families, especially with young kids, that may be something that you might be interested in. You can dump in almost $9,000 every year, and it ticks up year after year, $50, $100.
Yeah.
That's a nice little nest egg in the event, someone gets into gymnastics or football and, they start breaking stuff.
Yeah, and it's an aggregate amount, so it doesn't matter who you're using it for within the family, though.
Correct.
All right.
As long as they're part of your immediate family. They don't even have to be covered by your policy.
Right.
Oh, really? Okay.
Correct.
Wow. Okay, I didn't know that. That's cool. So, and I have 3 kids. They're all in their, well, one's 19, the other 2 are in their 20s. So my oldest, he's like, I have this HSA. It's at another company. It was started there 4 years ago. I still keep getting these statements. There wasn't that much in there. I think it was under 1,000. He's like, do I really need that? I'm like, well, don't throw away the money, but does it matter where it's at, or should he roll that into a different HSA?
Well, that's a really interesting question. So most people, they learn about HSAs through their employer group. And
Right.
if they wander off in a different direction, that HSA is still with whatever, system it originated in. But you don't have to keep it there. For instance, I set mine up through Fidelity. That I'm not,
Okay.
being paid by them, but I found that they were probably the best option for how I was using it. And so that's simply a quick application online. The money gets transferred within a couple of days, and then it just sits there. One thing that
Okay.
most people might not take advantage of that they should be allowed to do is if you set up your HSA with a financial institution that also does investments.
Mm-hmm.
Technically speaking, I am going to set whatever ceiling I want for my HSA contributions over whatever duration of time. For me, I've got 3 people in my family. I'm going to set aside 3 out-of-pocket maximums. But
Okay.
anything beyond that, I consider fun money. I can still make my contributions and get a tax deduction, but then I can immediately flip over money into my investment portfolio and potentially
Really?
make money off of my tax-deductible contributions. Now, if I sell those
I
stocks,
didn't know that.
I'm getting
Okay.
this cut. But at the same
Wow.
time, I have the potential of making money off of this.
Wow. Okay, I didn't know that. So, yeah, so that means that, it's there. You've already taken the tax advantage, and now you're going to use it in investments versus just letting it sit there as cash. Makes sense. I didn't know that.
The name of the game is to set aside whatever dollar amount you need if
Mm-hmm.
things go sideways.
All
Anything
right.
beyond that, that's your money to do whatever you want with.
Understood. Wow. Okay. Well, that makes sense. I wish I knew that earlier.
Well, I was talking with a guy who was moving into Medicare last open enrollment. He was turning 65. He and his wife had been on an HSA style program since they were younger than me, in their mid 30s.
Okay.
He had about 80 grand sitting in this HSA, and I had to break it to him. You had this option. I mean, imagine if in the 90s he put $10,000 into Microsoft or Apple or IBM, he'd be a billionaire now. So
Yeah.
that's something that I think most people are never going to take advantage of because it's not really common knowledge. But hey, if you're listening, go talk to your financial advisor.
Yeah, easily enough, it could easily just even go into a index fund. It doesn't have to go into individual stocks, so it could go into something safer relative to. So, all right. So now let's shift a little younger, maybe, or to self-employed. So if you're self-employed, you have a company, you're doing maybe a couple 100,000, or you're doing a few million. What's the difference there? As far as what should you be looking at if you're self-employed?
Well, it depends whether or not you have employees.
Okay.
If it's just you, you are in the individual market. With or without subsidy, you are in the individual market. But let's assume you have employees, not 1099s. Okay, there is a difference.
Sure.
But if you have employees, that opens up the door depending what you want to do with your health insurance. We have any number of small companies that come to us and say we are accustomed to having, and more than the employees we are trying to attract are accustomed to having dental, vision, short-term disability, all these other things, and medical. Those can be created once you have two people on the plan who are not husband and wife. So that's a starting point. But what I've started seeing in the last couple of years is a little different. A lot of people think I have a company, so I should be providing group medical insurance. And what we're seeing is that that may not necessarily be in your company's best interest, especially if you are a new company. And we're having a lot of conversations about what can you provide as an employer that an employee cannot get on their own, either as rich a plan or as cost effective a plan. And that really is the dental, vision, life, and disability, particularly short term disability. So we're starting to talk about packaging those things, letting the employees go to the marketplace or get individual insurance. Because what we're seeing is when an employer puts in a plan and it is available to the employees, they are no longer eligible necessarily to apply for a marketplace subsidy. And as a result of that, you are sometimes shooting people in the foot. So that's a conversation to really have when you do have employees. Before you pull the trigger, pay a little attention to what they've been doing for their health insurance and what they value. And John can go into more detail about all of these family opportunities where plans have to be minimum value and minimum affordability. So there are calculations where one part of the family may qualify for a subsidy where the other may be better off on a group plan. But there's some heavy conversation there right now.
Cool. So let me ask you this then. For example, I have a 19-year-old, and if I go into Medicare, so this is a little different, we're shifting a little bit, but if I go into Medicare for next year, which I would, he's not on my insurance anymore. I mean, he has to go for his own insurance. So he would go through .gov, I'm assuming.
Yeah.
Or Peach
Well,
Care.
extra layer of complication, is he paying his own taxes?
Yeah, probably not. He'll probably still be
Yeah.
dependent for another year or two.
So if you are still covering this 19-year-old on your taxes and getting your tax deduction, well, the government's going to make sure that your income is accounted for when applying for this child's insurance and subsidy.
Gotcha.
So it is a little bit tricky and confusing out there, and
Okay.
even to the effect that if we tried to apply this way and saying that you were, covered by Medicare, but your 19-year-old is coming in, the system may ask for documentation. The system may require that you submit proof of income or something like that. So there's a lot of barriers that a lot of preparation ahead of submitting an application is going to be very beneficial for you.
Okay.
Well, Enrico, let me add another thing. If your 19-year-old is in college, particularly if they're in the University of Georgia system, Kennesaw, Georgia Tech, Georgia State, whatever, the university programs are so much stronger than they used to be. Imagine a $500 deductible. Imagine a rate of maybe $150, $180 a month. It's a large population of an age group that is only there for a few years because they come and they go through the system. So it's not a long-term commitment on the part of the insurance company. And these kids generally don't have anything. So it's a very healthy group. So I'm saying to a lot of folks, look at your university system program, whether it's Georgia or whatever private college a child may be going to in another state. Take a real close look at what's available out there. It's much better than it used to be.
Oh, wow. I didn't even know that they provide that type of coverage through the university system. So they could just take it through that.
Yeah, you are required to sign off that you have creditable coverage or you're signing up over here.
Okay.
And the college systems, I believe they are still contracted with the United Healthcare, so you get access to a very robust network of providers and facilities. It still heavily relies on the school's clinic system for the minor stuff, but if something big pops up, you get access to a national PPO if nothing's changed. At this point.
Okay, cool. All right, so what at this point, what have we not covered that John, that you feel that we should be covering right now in our conversation today?
I would say being strategic about this. So Erica touched on this, and you had another prodding question. So if I am employed by a company that is offering benefits,
Hmm.
I'm stuck. My option as an employee is I either accept the coverage and the employer contribution to help with my premium reduction, or I'm on my own. But things have changed at the federal level when it comes to calculating affordability. And nowadays, the remaining family members, they do have the option to split off from you, go to the individual market, and potentially be found eligible for subsidy. So that's something that we have been encouraging a lot of our small group clients to consider. We are one of these unicorns out there where we operate in all three markets on a daily basis. So, individual under 65, Medicare, and groups, where it may make sense to have a dual option internal to your household. And especially if there are different sets of needs between one family member and the rest of them, that may make a lot of sense. Unfortunately, on the individual market, everything is an HMO, which means
Right.
that you will be staying in the established network with whichever carrier you choose, or else you're on your own. The insurance is not going to step in. But these plans and networks have been getting a lot more accessible over the years, and that is primarily because the hospital systems in a lot of metropolitan areas, they're getting fractured, and they're signing uh, individual contracts with specific insurance carriers.
Hmm.
So, for instance, in Atlanta, the big ones are, I'm probably going to forget someone, Piedmont, Northside, Wellstar, Emory. And if you're up here in kind of the northern area, maybe Northeast Georgia Medical Center. Um, if I choose a Blue Cross, or if I choose an Aetna or a Cigna, I do not get access to all of those hospital systems. And so I do have to be pretty diligent in which program
Mm.
I'm opting into if I maybe have a planned surgery coming up and I would prefer to be in one
Right.
hospital system versus another. So that is one layer of complication that a lot of people, they say, "Oh, I know that company name. That's a household name. I can
Hmm.
probably trust them," and they opt into something without doing the due diligence to figure out, well, are all of my providers in network, or am I
Right.
going to get only a handful of them? And in a
Right.
lot of cases, I have to have pretty stark conversations. Which providers do you care about the most?
Right. That makes sense. And specialists, they might be, someone that has a specialist that they work with over the years. They don't want to lose that person, or medication that they're taking. That I've seen some health insurance will not cover certain medications, but they'll cover something within that works the same way, maybe quote works the same way, or the generic versus the labeled, or sometimes they won't even cover certain medications at all that you may be taking. So it's a
Now,
bit
sometimes
crazy
that's
out there.
bad, and sometimes that's actually to your benefit. So,
Mm.
in a lot of cases, when we have clients that do have prescriptions, whether it be on a group, Medicare, or under 65, it might be a gift that your plan doesn't cover that medication, because that might give you the opportunity to go to the drug manufacturer's website, apply for
Mm.
their discount program, and take
Right.
advantage of that.
Right.
There are all these, fine print stipulations where, in some cases, if it is covered, you get in. If it's not covered, you get in. So it's different, between different medications, but
Right.
they want you taking their drugs. If they're willing to
Yes, God
subsidize
knows.
that to
Yes.
make sure that you are a card carrying member of their
Yes.
prescription
Yes.
cult,
Yes.
then that's their option to make that an option
Yeah.
for you, or available to
Yeah.
you.
Americans are funny that way. I guess if you were using Crest toothpaste since you were a kid, you're probably still using Crest
That's right.
toothpaste, right? So it's similar to medication, right? Most people won't get off because they know that works for them.
I
The
wonder how many Aqua
efficacy,
Touch people are listening to this.
go figure. But yeah, Americans are funny that way. We do stick with our childhood brands in some ways for the long run. Erica, have we, winding down a little bit in this conversation, have we missed anything that we should touch upon from your point?
There, there is for the employers, for the employer-based plans, there are a couple of things that are not being discussed that I think are important.
Hmm.
Um, and the biggest one is compliance. If I have a small company, if I have a big company, there are certain things that I must do for the federal government, or they get very upset and start fining me. Penalties, taxes, fines can be debilitating. So if a company is working with a broker, make sure that they have gotten their compliance lined up. There are deadlines. On X date, this needs to be filed with 35 cents per belly button. I mean, stupid stuff, but you miss the deadlines and it can be a big problem. We've had one company that came to us that had massively bad health history, and they were facing for January of 23 a massive rate increase over what they already couldn't afford. And came and asked us for another alternative, and we came up with an ICHRA, which is an individual coverage health reimbursement account. So imagine you've got 60 employees running around, and if I've done my job right, Rico, nobody's happy. It doesn't have your doctors. It's too expensive for JJ. It's richer than one of you. So what the ICHRA does is it says, everybody, here's your dollar amount, go shopping. And it's a portal similar to healthcare.gov, but you want a rich plan, you want a lean plan, you want these doctors, you want that hospital system. Right. So that's an alternative. It is still new. There are still glitches in the system, but that's something to keep an eye open for in the future.
Cool. Right. We've what I'd like at this point, and we've arrived towards the end of our time together. I want people to know where they can. So, for example, you charge a fee if someone wants to come to you to have you all handle it, right? For Medicare, let's say. For Medicare. Yes. Yep. Is that tax deductible by any chance?
Unfortunately not.
I sort of knew that answer, but I thought it was. All right, so if someone wants to come to you to get your assistance, whether they're a company or an individual, how would they find information on you all?
The website is cdainc.net, cdainc.net. Our phone number is 770-449-7369. And if you want to reach any of us, the emails are simple. It's our first name, in my case, Erica, in John's case, John, at cdainc.net.
Okay.
And if the nice thing about us is that we're local. You can find us. You can track us down. Yes. We're not some unnamed or mask over who's actually helping you. It is us. We are in Peachtree Corners. We are in Tech Park. Come knock on our door if you really want to get our attention.
Yes. The good part about John and Eric is that I see them at Southwest Gwinnett Chamber. They've been at the PDC coffee meets Wednesday morning in downtown Norcross. So they're very involved in the community. They're out there talking about this, giving free advice out there as well at these speaking engagements that they do. So do reach out to them. They are Peachtree Corners-based and members of the Southwest Gwinnett Chamber. So cool. Well, thank you guys. I appreciate you spending some time this afternoon with me talking about Medicare and insurance and open enrollment and all that. Before we leave, though, hang with me for a minute. I just want to say thank you to two of our sponsors, Clearwave Fiber, a company that does business internet and residential internet, but they have over 1,000 businesses in Peachtree Corners they work with. They, too, are local to a degree, and they have reps here, so they're not your cable company guy. So if you need to find out a little bit more about how they do their services for your business, check them out, Clearwave Fiber. And also EV Remodeling Inc. They do design to build, renovation work on your home, indoors and out. Eli is the owner of the company, lives here in Peachtree Corners, great family. They do good work. So check them out also, evremodelinginc.com. So thanks again, Erica, John, appreciate you being with me.